Okay, first of all, thank you very much for coming along to today's event. My name is Eva Echo. My pronouns are she, they. I am a trans activist, a writer, public speaker, a number of organisations I'm involved in. I sit on the Crown Prosecution Service's hate crime panel. I'm head of communications and engagement for Birmingham Pride. I'm also brand ambassador for the London Transgender Clinic. I've been working with Anti-Cancer now for just about a year and a half or so. And it was born out of this discussion about trans people. I mean, I use the term trans people as an umbrella term that includes gender non-conforming people, non-binary. But basically, there's this idea that trans people don't feel fully included in healthcare. I mean, our trans healthcare itself is in a bit of a mess at the moment, but when we look at ourselves in other areas of the NHS, specifically things very, very personal, quite invasive, like cancer screening, it dawned on us that there are lots of gaps and there's lots of room for improvement purely because of who we are. The nature of our existence often challenges people because they don't know how to deal with us. You know, you only have to look in the media to see how politicized we are. And that itself raises areas where we need to work on saving lives. Cancer affects everybody. It doesn't pick and choose. And therefore, we need to make sure that cancer screening services are as inclusive as possible. It's not about wokeism or changing everything or erasing anybody. It's just expanding definitions and being mindful and respectful of other people. Now, I'll talk a bit about myself. I mean, I came out quite late on in life. Don't let any of this fool you. It's just lighting. I mean, I came out just about 5 years ago at the age of 37, and I basically spent my entire life up until that point in denial, not wanting to be me. I mean, you know, unfortunately, I did put an expiration date on myself because I never thought I would be here, quite honestly. I knew that I wouldn't say I knew I was trans. I knew that there was something about me that did not fit in with all the kids around me from the age of about 4 or 5, which is typically when children become self-aware. Now, it's important to recognize that not all trans people know at quite a young age. By and large, they do, but it's possible that some come out later on in life and they only realize later on in life, and that's still okay. Doesn't make them any less trans. For me, my life was just riddled with mental health struggles because I did not know how to deal with me. I couldn't understand me. How could I expect anybody else in the world to understand me? There's the fear of being judged, being mocked, being abused, assaulted. And I spent so much of my life trying to distance myself from that, trying to present as masculine as I could. But unfortunately, that affected my mental health. I suffered from eating disorder for most of my adult life, severe depression, some self-harm, all sorts. And it got to the point where I really didn't care. And compared to where I am now, it's like going from one extreme to the other, because now I do care. Since coming out, you know, it's like a huge weight has been lifted. It really does feel like that. But at the same time, another weight has been applied on me because I face new struggles. The things that I took for granted previously, I can now see from the other side that much of society takes for granted and doesn't often realize it, including things like health services, the provisions that we provide, even just things that we look at the gender marker on your medical records. Since I came out, I went to my GP and asked for a referral to my chosen gender clinic. I've been waiting over 4 years now, and I'm still waiting for my first appointment with the NHS clinic. Typically, the waiting time should be up to 18 weeks, according to NHS legislation, but that's its own issue. You know, just because the gender clinics themselves are having those issues, that doesn't mean that trans people should suffer in other areas of healthcare. I had my gender marker changed on my medical records, so it now says female. Now, one of the things that I found when I came to terms with being trans was, I don't know what to do. There's no book on how to be trans. What is trans and what journey one trans person takes is very different to another or to anybody else. It's a very personal journey. No two journeys are the same, and not all trans people need medical transition. Some transition socially. That medical aspect in terms of surgery, for example, or hormone therapy, that doesn't define us. It just simply is there to help ease gender dysphoria. So I found that I had these questions when I went to my GP. What do I do? My GP didn't know. And that's when I thought, this is strange. I came to you for help. And that's when it dawned on me that there is so little awareness within the healthcare sector about trans identities, trans experiences. And it came to me that having my gender marker changed meant I would no longer be invited for certain screenings. And it doesn't just affect trans women, it affects trans men as well. And that is something that we basically need to be aware of and educate, because as a trans person, it's up to me to know when to request those screenings or to look out for certain signs. But if nobody educates me, nobody tells me any of that, what to look for, when I should be, going to my doctor, I may as well just ignore it. And sadly, even when, as a trans person, when we do receive those screening letters, they can be ignored. And that is a number of reasons, really, because we're fearful, quite rightly so. We are being debated in the media. People don't understand us. People spread misinformation about us. But we're not always invited to defend ourselves. We just want to exist. We want to exist peacefully. We're not trying to erase anybody. We're not trying to take over the world. I know we've been blamed for what's going on with over in Ukraine at the moment. I'm sure at one point we were blamed for Brexit as well. And you know what? That's not going to be the last time. We will be blamed for all sorts. We just want to exist. And we are so fearful of our lives that we don't know how to go about that. We need support, we need allyship. And as medical professionals, we look to people like you to help us, to guide us, and to include us in the things that you provide for patients. So when we get something like a screening letter, the first thing that will probably pop into our minds, and I can't speak for everyone, is, somebody is going to see me in a very personal way. And I can tell you right now, I am fearful of receiving any screening letter. I'm fearful of even finding something and speaking to a GP, because once I get referred to the screening services, how will they take me? Will they know who I am? Will they laugh at me? Will they judge me? Will the person, on the other end of the phone when I make an appointment, will they be transphobic? I don't know any of this. I can only base it on my own experiences. And when I have phoned the police before to report hate crime, various things like that, I have been misgendered. I have had to explain over and over who I am, justify my gender identity. I don't want to do that every time I have to phone someone for help. And that puts me off phoning to make an appointment, or would do. And working with Anti-Cancer, we created a documentary, just a little short 5-minute film, where I interviewed 3 members of the community to ask them similar things. I wanted to find out, was it just me? Was it because I asked too many questions? I'm very curious, or was it a wider issue? And I found that I definitely, it's not just me. I was not the only person. And I'd like to share that with you today and allow those people to tell you how they feel, because I feel it's important in order to create that awareness, to create positive change. We need to hear those voices. We need to include them. So Martin, if you could play it for us, please.
When I received the letter for screenings, I didn't really have much feeling. It was just kind of a little bit of dread, maybe a bit of fear. And then I just ignored it. I think trans and non-binary people don't show up to screenings because they don't have enough information, and because they feel that they may be judged going into those situations. and would rather just avoid it.
I feel like trans healthcare, when it comes to cancer screening, is not one of the things that is on the priority list.
I think trans and non-binary people don't go to screenings, possibly because they're scared of the reaction of other people at the screenings, they're scared of the reaction of the staff doing the screenings. All the usual, do I have to pass? If I don't pass, am I going to be treated badly?
I think maybe being put in that environment and you are passing as a cis male, in my instance, then everyone is looking at you wondering why you're there.
I think it's easier for me as a non-binary person when I've gone for screenings and whatnot to sort of approach it as like they're going to see me as male, so I'm just going to make this easy for myself. I'm going to dress male, mass presenting, and roll with the he/hims and roll with the male idea that I feel this doctor's going to project onto me.
If I could say something to those people in the waiting room, I would just tell them I'm here just like you are, just to get myself checked up and make sure I'm healthy.
If I was in the waiting room, I'd want to say, I've every right to be here.
It's a piece of fabric, because that's the thing most people go to, is they see gendered clothing, and I'd want to say that, like, clothing isn't gendered, and that how I present isn't my gender per se.
I think the process could be made much more inclusive just by educating the people who you will be dealing with as to how you will be feeling in those instances. Vocabulary that might be used, knowing that the people I'm going to speak to throughout have an understanding of my needs, just kind of feeling as though they're on your side and they just want to make sure you're healthy.
My gender identity might not fit the biological bits and pieces that I'm currently made up of, but it's still my gender identity.
I should still be able to get those screening opportunities.
I would not feel comfortable correcting someone about my gender identity if they misgendered me. There's always that apprehension there that they're not going to understand, or it's going to open to other questions about the gender identity.
I would want screening technicians to know that the process is already difficult, just getting the courage to come in. So keeping that in mind throughout the process.
Put out the hand, and I am willing to take that hand. So 100%, and that's all it takes.
Thank you. So, I mean, that's just 3 people that, that I put out something on my social media inviting people to come and give their thoughts on it, really. And, a number of points have been brought up. I mean, the first one that, when I was putting this together, that really stuck out is when Sam said it's a piece of fabric. If I was to turn up to a screening service in a dress and I wasn't, if for example, if I didn't pass as a cisgender female, I would instantly feel like I'm being judged because of fabric, because of this social construct that, a dress can only be worn by women. But what if a man just wanted to wear a dress? That's the thing. We need to pull these things apart in order to move forward and to create that change and change perceptions. Because, as one participant mentioned, they have every right to be there. It's a screening service that's open to all. We should be looking at them as a patient, as someone that's asking for help, who needs a screening, not for what they're wearing, how they're presenting, how they choose to live their life. It's not really for anybody else to judge. And it's very important because as trans people, we face that difficulty having to justify who we are, even in a doctor setting. It's unfortunate that there are so many GPs that are still very reluctant to deal with trans patients, often dismissing it as mental health issue, go and speak to somebody else, or it will pass, it's just a phase. Or they're very reluctant to refer to a gender clinic because they themselves don't know, even though there are guidelines. even though there is a process, that if that doctor's own personal opinion gets in the way, that affects that patient. Now, I have a friend, Claire, who is a practice nurse, and she was due to come and speak today. Unfortunately, she's been called into work, but she has recorded a little brief message for me to play to you. And even though she is based within a GP, within primary care, she deals with trans patients, and she sees from day one, our first port of call as a patient, the difficulties that the trans people face. And if we don't have that confidence within our own GP setting, how can we have confidence as we move forward through the trust and the processes? So Martin, if you could play Claire's video for us.
Hi everyone, my name is Claire Carmichael and I'm a registered nurse who's really passionate about creating change for our transgender patients. I was a newly qualified nurse in January 2020 and I went straight into general practice to be a general practice nurse, and I didn't really think about transgender healthcare as such. I'd never had that training at university. I've never had any training ever actually on transgender patients and their needs and hormone treatments and things like that. Until I was sat in my clinic one day and I was faced with a transgender patient and I was giving them the testosterone shot, and I sat there and I thought, wow, I don't know what I'm giving. I don't know what dose I'm supposed to be giving. Obviously we have the prescriptions and things that tell us. I don't know the effects on the body of this medication. I've never had training on transgender patients and I wanted to know more. I wanted that training so that I could give the best care possible to the patient that's in front of me, so that I didn't cause harm, that I didn't discriminate by accident, that I wasn't doing things that I shouldn't be doing. I wanted to give this patient the best care possible. So I went to the GP partner at the time and I said to them, listen, I've got this patient, I really want to gain more knowledge, I want more education around it so that I can give the best care possible to my patient. And I said, I need some more training. So have you got any pointers? Have you got any training packages? Is there anything out there that you know of? And I was just directed to a standard LGBT webinar. It's not what I needed. It's not really what I asked for. I wanted transgender patients specifically. And doing my own research out there, there is nothing, absolutely nothing. There's training if you work in the gender identity clinics, but that's specifically for those nurses and doctors that work there. There's nothing across the board within the NHS that I can see on transgender healthcare. So I went out there and did my own research. I've done days, hours, weeks, months. Like, this has been ongoing for the last 2 years. I've been researching transgender healthcare, the evidence-based practice, the guidelines around it. I took to social media back then, like 18 months plus ago, to speak to transgender people, to speak to the patients themselves, because who better to speak to than the person themselves? It's what we do with conditions. It's how, you know, we do our research and our evidence to be able to practice as nurses and doctors. So I wanted to get that insight from people. I also arranged a day with the London Transgender Clinic. I went and spent the day with their nurses and spoke to their patients. I saw everything that they do and I was just blown away by the care that they received from these nurses. They were so knowledgeable. It was amazing. And I think many people think that private services like this for transgender patients are just people that are down a back alley that don't know what they're doing. The London Transgender Clinic in specifically, and Gender GP actually, I know there's a lot of news about them at the minute. However, I've also had meetings with Dr. Helen Webley to gain more insight into this. Both these people, they are registered healthcare professionals, they are nurse prescribers, they are amazing at their jobs. The London Transgender Clinic especially, these people, you know, the Mary who runs the show there, she was a GP nurse and she's so passionate about transgender healthcare, and they work with endocrine specialists, like one of the top specialists in the NHS in London. They are working with psychologists, they are working with all these healthcare professionals to get the evidence to be able to treat their patients. However, something that I noticed, every single patient that I saw that day all said that their GPs were refusing to share the care. So once they've gone private to get the hormone prescriptions and things like that, they're going back to the GP, who should really be sharing the care with services to provide this on the NHS, because it is an NHS service. We have the GICs, but those needs aren't being met. The doctors have said to them, sorry, I don't understand your condition, I don't understand what these are for, and they're just writing them off. This is not fair. This is discrimination in a way. And I say that because I had a 14-year-old boy, not transgender, but he was prescribed some testosterone for a rare condition by an endocrine consultant at a hospital. GP took that on, prescribed the hormone treatments, no problem at all, when this was a rare condition that they didn't understand. However, if that was patient that was transgender, it would be a different story. Would they prescribe those medications still? And this is why I'm saying, you know, I don't want to say that people are actively discriminating against transgender patients within the NHS. However, it is out there and it is happening because people aren't sharing the care. People are just fobbing people off because they don't understand what these prescriptions are for. They don't understand the hormones. They don't understand because there's no training, there's no awareness. And we need that within our NHS. We need more. And this is why I did my own research. I've worked with Eva, who is absolutely amazing. She's the best activist and just the most knowledgeable person on everything. I worked with her to sort of set up a webinar to deliver to healthcare professionals, which I'm doing currently now. I've had offers from universities to provide them with these webinars, which has just been amazing and a massive start. And this is what we need. We need this rolled out to all NHS services, primary care, doctors, nurses, everyone who will listen, because we need that education, we need that training to give the best care possible to transgender patients. This can't be happening anymore. You know, it's 2022, things are changed, times are changing, and the education needs to be out there to stop discrimination happening, to stop, the care being affected of these patients. I'm sorry, I did go off a little bit on that one, but I'm just so passionate, and the more research I do, the more guidelines I see. There's so many guidelines out there. NHS have provided their own guidelines, Endocrine Society have provided guidelines on hormone treatments, best practice, treatment, aftercare as well, monitoring and management of transgender patients and hormones and things. There's so much out there that people aren't using, and I don't know why, and I don't know why people aren't doing their own research, but definitely more education and training needs to happen, because it's really sad to hear the amount of stories and the amount of things that people are saying that they're not getting the best practice from our NHS. And that really worries me, because our NHS should be the best in the world, and it should be given the same level of care to everybody, regardless of their sexuality, race, disability, gender. We should be all treated the same. And thank you so much for listening, and I really hope that today is the start of some positive change for our transgender patients.
Thanks, Martin. So yeah, that's Claire, and unfortunately, yes, there is discrimination. I've been discriminated against, and it's not necessarily bad thing when you hear discrimination. Everyone thinks, that's disgusting. It can be various levels. It could just start off with unconscious bias, and that's something we all need to unpack, because it is that unconscious bias that can lead to negativity. It can lead to discrimination. And ultimately, as Claire was saying, we need to all work together to listen to the voices and make sure that the resources are there so that we can move forward and build on that. Coming up to 1:30, I know there's been a lot of info thrown at you. At this point, we're going to put you into breakout rooms and just have a bit of a discussion. Are we able to do the breakout rooms? We were trying to figure this out earlier.
Yeah, no, I don't think we are, but I think that we could have an open conversation anyway, and people could put their thoughts into the chat. I know that Kay's been very positive and active in the chat already. But no, I think we could still ask the same question and just have a big breakout room, which would probably be easier.
Yeah, I'm happy with that. I mean, just to start things off, given your knowledge and your experience of the screening process at the moment, how do you all feel about hearing what you've heard so far? Do you think that your service is able to cope with trans people and offer them an adequate level of care that is inclusive?
Has anybody got any hands up, or are you happy to put your thoughts into the chat if you if you'd like. I mean, I think probably another way to rephrase it is to really get an idea off the back of this presentation today is, you know, what can you take from today and how could you see it implementing change in your setting or in the settings that, you know, that you oversee. Anastasia said they've got some comments if you want to jump in.
Yeah, I'm here. Hi, Vanessa. My name is Anastasia Mekugwadu. I work for NHS Improvement, NHS England and NHS Improvement as a system transformation lead. My colleague and I, who is also on this call, Maria, we've been doing a lot of work to address inequalities. And in the past few months, we have really focused on improving access and quality outcomes for the LGBT plus community in general. And we reviewed the screening pathways, and we have found that the processes and also the clinical system has made it very difficult to identify transgender people for screening because of the way the system, of the way they are coded on the clinical system. At the moment, most of the clinical system that the GP use either allows the GP practices to register people either as a male, female, indeterminate, or unknown. So which means if screening invitation is sent out, there will be a problem because quite a number of people will be missed. And it also means that they can't do any follow-ups. So what we did in our region, we developed a flow chart. So just advising the GP practices to let them understand if someone is assigned male at birth and and has registered as a female, just enabling them to see the crack within the pathway so that they have their own monitoring process inside the practice. And we also did advise them to undertake audits, to go back to the records to see where transgender people have been missed from screening invitations so that they can be recalled. But the problem we have been having, in fact, we had one of the GP practice email us yesterday to say they find it very difficult to undertake the audit we've requested because there is no coding on the system and it's quite difficult, which means they have to go into all clinical records. So what we've asked them to do is to run multiple, use multiple metrics to run the records. So they can probably check when someone moved into the registered with the practice, which tests have they had in the past and how are they registered, and just use multiple things, which is very cumbersome for the practices. So I think we do have a system problem. And we have to, as healthcare providers, understand what the limitations are and work together to address them. It's going to be a long way. I don't think one process will fit all, but it's just people being aware of what the issues are and begin to come up with solutions to address them.
That's wonderful. Thank you. We've got a comment from Fiona Simmons-Jones and then Hannah Berry from GMC Rose got her hand up. So Fiona said, I find it problematic that trans individuals are often expected to proactively ask for or seek out screening that they're entitled to, and when we do not expect this of other patient groups. I feel this presents a barrier that is discriminatory, and there should be a national push to sort out recording in IT systems. So this is not the workaround, which I think is exactly what Anastasia was saying there. Hannah, did you have your hand up?
Yes, thank you very much for that. I was listening interestedly to Claire's video about the lack of kind of sort of professional training that she found, well, that she found that wasn't available. And I just wondered if anybody here is from Greater Manchester and aware of the Pride in Practice training, and whether it, because I have always assumed that how to look after trans patients is very much part of that programme, which has been going for some time now in primary care in our area. So I just wondered if anyone's got any comments on whether that fulfills the kind of the sort of thing that Claire's doing down in London for the Greater Manchester region.
I think,
Can
I don't know if,
Yeah, I have a comment on that. That's one of the things we do. We've recently commissioned LGBT Foundation to provide Pride in Practice training to all our screening providers in the region. So yes, we're aware, and we think that's a smart way of providing the training required as well.
And I think they've been trying to look into demographic monitoring, haven't they? Sexual orientation and trans status monitoring for some time, and how that can be done systematically, more efficiently. So yeah, I hope that that's soon not, a problem of the past. Thank you very much.
welcome. Thank you, Hannah. Kay actually said in the chat, I think we all try, but from the PMs that I speak to, they are worried about getting things wrong. They don't understand pronouns. And as someone said, the training isn't there. I always promote Pride in Practice to them, which is a fabulous way of open learning, judgment-free learning. But if you're struggling with your own practice, maybe you could direct them there. So that would link to what you were saying, Hannah. And then we've got Stuart, who's put some information with regards to Owen Carter. All the links will go out in a follow-up email, as well as some links to the LBGT Foundation. Maria says, to add on what Anastasia said, we have the EAST of England commissioned the LBGT Pride in Practice for screening programs. I mean, it's really great about the Pride in Practice, and I didn't know about it, and I've spoken to actually quite a few people, nurses included, who actually did voice that they felt that they didn't receive the training that they needed to feel that they could have and provide an inclusive service. And there is that fear, I think. People are going to get it wrong, and I'm sure Eva will say here, it's not about, we're not going to suddenly go, oh my God, what are you doing? You've said the wrong pronoun. If you just say, oh, I'm really sorry, I'm not sure, or people that are trans people don't want to be seen as different, so if you get something wrong, we're not going to go, oh, this is descriptive. If you just say sorry, or and I mean, jump in here, Eva.
I'm just about to say that, yeah, I mean, I've been misgendered so many times, and sometimes I'll let it slide, sometimes I'll pick up on it, because quite frankly, I'm tired of it, having to justify and explain my existence. But I do recognize signs, I do recognize gestures. Pronouns are such an amazing yet very simple way to show you are an ally. Not just that, to show that you understand the importance of what little words like pronouns can do. I have now, I always give my pronouns when I introduce myself. It's just become the norm now. And in the same way that you would extend your hand when you meet somebody to shake it, you offer that hand. Why not offer pronouns? Put it in your email signature. Normalize it to the point where it becomes okay to ask for pronouns, because there is this hesitancy, referring back to what Kay puts in their comment. If you're not sure, ask. Or if you're not too sure about asking, you feel a bit shy, just use they, them, their. It applies to the singular as well. And don't dwell on it. That's the most important thing. If you accidentally use the wrong pronoun, just apologize, move on. Don't dwell on it, because when you dwell on it, it creates this tension, and the trans person is just going to be stuck there thinking, this is awkward now, this is really uncomfortable. And as Vanessa said, we don't want to be treated differently. And unfortunately, no thanks to the media, it's portrayed that we do want to be treated differently. We are asking for more than what everybody else has, when quite simply, we're just trying to say, look, these are little ways that can help us, that don't really impact, they don't really do much else to any other people, but for our particular group, it would mean the world. When I go to a restaurant and I see a server with pronouns under their name, in the name badge, straight away I am relaxed. They don't have to say a word. I see that and I straight away relax, because I think they understand. And that, they might not fully understand, but for me, in that moment in time, I'm assured. I can put my trust in them that that is a safe space that they've created to welcome and include people like me. And there's a lot of work to be done, unfortunately, and looking at whether it's a system, an IT system thing, or even just changing perceptions. There is a lot to do. So yeah, I encourage everybody to don't be afraid of getting it wrong, because it's a learning process. I've had a lifetime to come to terms with being trans. I would not expect any one of you to understand straight away, because you've only just met me. And it's okay, I transition to be myself, to live authentically, to be happy. People, allies such as yourself, people who watch us transition, in a way, you go through your own transition as you adjust, evolve, and learn to live with trans people in your world as well. So it's a learning exercise, and that's why it's important to hear voices and to exchange, and not to be very so militant in approaches. And an example I always give is like Extinction Rebellion. Great message when it comes to things that we need to be aware of. Climate change is a thing, but how they went about it, those actions deterred people from wanting to listen to that message. That message was lost. So we need to find constructive ways, both sides. I'm not saying that, as a community that we expect everything and we're ready for it. We're not. I mean, there's a lot of learning that we need to do as well, but we're so guarded. We need to learn to let that guard down. Mm-hmm. And there's no point in me saying to, on social media to all my followers, look, screening is safe, screening is important and inclusive, go for it, when all it takes is one person to say, actually, I went for screening, there's a horrendous experience, transphobia, discrimination, whatever, that feeds back through the community like wildfire. So before we turn to the community and say, yes, it's safe, you should be doing this, we need to make sure that the healthcare side of it is robust, everything is in place, and if things aren't in place, we need to start implementing them now.
Absolutely, no, I agree. Marla, I'm so sorry, your hand's been up for a little while, so did you have a question?
I guess I was wondering about, so in my experience, I'm a trans person myself, and I think that it's really encouraging hearing about people like Claire and everyone who's sharing in the chat about like best practice and things like that. I think one of the main problems is that when you are a service user, you can't tell whether or not your GP practice has gone through these kind of trainings. So you're kind of stuck, throwing jelly at a wall type thing to find the place that is going to be accepting of you. So I was just wondering, is there any drive for sort of mandatory training? Because I think, like, as much as everyone's within their right to have a certain opinion or whatever, like, it's really discouraging to have to go through GP after GP to find the one that is actually going to treat you right and not knowing which one it's going to be.
Yeah, great point, Marlo. Just to jump in there, I mean, I moved house during the first pandemic. I would not recommend moving house when nothing is open and you can't get access to anything. But I had to look. I was going through the website, the NHS website, trying to find a GP, thinking who would take me on. I've had to go private whilst waiting for my space at the gender clinic. So I don't know when I'll be seen at my gender clinic. At the moment, it's likely to be another couple of years. So I need to make sure that I can look after myself, essentially, because I have no one else to rely on. But what GP surgeries out there can I turn to? Because there is nothing to say they are LGBTQ plus friendly, fully inclusive, as Marla's pointed out, that they've had that awareness training. Because there's stuff on websites at the moment, very basic guidelines, and from people that I've spoken to, their own GPs haven't even read that. They aren't even aware of it. And sometimes it's forgivable because they're so busy. They deal with so many patients. They are general practitioners. They can't be expected to know everything. But at the same time, they should have the basics. And I think it should be something that is put out there, so that there is a consistent level of service and care to all patients.
Brilliant. So I've got a message for you, Eva. So when people, from Hannah, when people transition or self-ID or otherwise, are they encouraged to contact their GP to let them know about their new gender or pronouns?
Yeah, I mean, it's a very personal choice. Whenever you transition, if you choose to transition, obviously you'd need to update things like your bank records, council tax, driver's license, etc. You let your GP know, but it's down to how far you want to take it. Not everyone wants their gender marker changed. Not everybody wants the medical transition, and it's down to the GP to work with the patient on an individual basis to find out their needs, and then for the GP in their practice to meet those needs and to have things in place for them. There is a very standard practice when it comes to changing the gender marker. Unfortunately, not every GP knows about that. I had to delve into pages and pages of the NHS website to find certain articles to then take to the practice manager and say, this is what needs to be done. And the thing is, trans people shouldn't have to do that. We have so much going on. We're trying to survive and keep our head above water, yet we then have to take on the role of educator when we're our most vulnerable and we need help. So yeah, I would say speak to your GP, because even if you choose not to medically transition and go down that HRT route, for example, or ask for a space at a gender clinic, ultimately, if you'd want even if it's just your name on your prescription, speak to them, but then work with them and be patient as well. That's something I'd always say to all patients. Be patient with your GP, because it may be the first trans patient they've actually dealt with. My GP is willing to learn, and I'm very fortunate in that. And again, I guess we need that consistency across the board.
Fantastic, thank you. I've got a message from Marlo from Kay. Marlo, Kay was saying that GPs should be displaying their pride in practice notice, and making sure that it's people are being made can easily see that they are sort of had that training, and that they should be able to give you the care that you need. You shouldn't have to go looking for the right one. Anastasia has said some of the CCGs in the east of England have also commissioned pride in practice training for general practices in the region, which is brilliant. Stuart from Live Through This has been, I actually was hoping to get 5 minutes of your time, Stuart, but I'll read this out anyway. They've been pushing for mandatory LBGT education in core medical curriculum for the LBGT sector, but it's a slow push due to the complexity of the systems and the variation in royal colleges, etc. But we are trying, and that goes for one of the reasons why this documentary is so, because it's all part of that sort of trying to move that sort of voice and that change.
At this point, in fact, I just want to give a shout out to Stuart for and the team at Live Through This, because they are the UK's only LGBTQ+ cancer support charity, and it's important to acknowledge the need for that, because LGBTQ+ people have certain nuances that need catering for, and whenever it comes to healthcare, it's not a one size fits all. We all know that, but some people have more needs, and it's important that those needs are addressed and that people are aware of those needs. And the work that Stuart has been doing is absolutely phenomenal in trying to create that change. So yeah, I do encourage everyone to get in touch with Live Through This, who offer a lot of support, a lot of training. And Stuart, I mean, if you want to say a few words, you're more than welcome to.
I would, although Stuart, just before you do, say, because I think we'll end, we've got 10 minutes, so we'll end. I just want to reply to a comment that's been put in the chat, and it's from John Shuttleworth, and I can see the comments. However, I don't feel that making service provision for the transgender community is any different than being inclusive for all different colours of the rainbow and all different types of need that there would be. So although, yes, I do see why you would make the comments, I think that it's not that it's an expectation, it's just something that should naturally evolve.
Can I just say on that? Yes, trans people are approximately 1% of the population, John. You know, it does, on the face of it, seem like, I don't know, blowing up a house just to kill a spider that's run across your living room floor. You know, it seems like a lot of effort for what's relatively a small group of people. But they're people. We are people. And when we ask, for example, as a trans woman, when I say that trans women are women, we're not erasing cisgender women. We're simply broadening that definition of woman. You know, we've grown up living under society's unwritten rules. Blue for boys, pink for girls. This is what a man does. This is what a woman does. No one's ever questioned that. You know, those unwritten rules are passed from generation to generation. No one ever questions it. We simply follow it blindly. What about intersex people? How do they fit into those unwritten rules? You know, there's a lot of work and a lot of talk about trans people, but what about intersex people? There's even less of them and even less discussion of their needs as well. They have very unique health needs as well. So yes, I appreciate that it does seem like a lot of work, but the NHS is a service for all. And right now it isn't, because it's a service that's geared towards people who those unwritten rules do apply to. But they, like the rest of the world, society is constantly evolving, constantly changing. And it may seem like a lot of work, but in the grand scheme of things, it's not. Remember when NASA declassified a planet, there was absolute uproar. It's just a planet, it's just a rock. Everyone's like, oh, we need to change books now, it's disgraceful, but it's change. We need to adapt as we move forward. I'd like to bring Stuart in, if you can, if you're ready.
Yes.
Stuart.
I'd love to. Sorry, I just want to say that I just want to shout out to, as well, to Stuart, who is part of the Answer Cancer programme, who is getting involved in some exciting, really, really passionate work around cancer in the LGBTQ community, not just transgender and non-binary. So absolutely, you know, I couldn't think of a better person to have closing comments. So take it away, Stuart.
Yeah, I sort of was hoping just to kind of hide away this time in the comments section, but here I am. Nice to see you, Eva. Always doing great work, and so good to see the video as well. I think it's so important to have patient voice, and also actually acknowledging the strength it takes for patients to come forward. We always know that there's a difficult power balance there with your clinician, especially when you're trying to speak up for yourself. But then also when we create media like this, like Eva's done, actually the bravery of people being seen on screen, advocating for themselves and their community. So I think there's a lot of appreciation that needs to be done for that. But there is really great pockets of work. And I think sometimes a lot of this work ends up existing in silo because they are limited fund projects, or they have sort of limited scopes because of where they're funded. So that's why it's important events like this happen, where we can connect and we can share best practice, like the stuff Kay shared, which is fantastic and it's just gone up on our social media. I've put a bunch of links in the chat about some campaigns we've done as well, especially about really empowering people to access screening. I think one of the things we've heard from our focus groups when we look at breast screening in particular is that patients feel like they're being driven to screening, but there's no real assurance that screening services have got better and more inclusive. So it's thinking not only just, okay, can we stick a stock photo of a trans person on a poster, which happens too often, rather than actually looking internally and thinking, do we have inclusive policy? Have we really thought about how this person is going to have a good experience? Have we thought about additional measures like allowing the patient to call us beforehand to talk about some actions that may make their experience better? Or if you're in a very gendered environment, like if you have a breast clinic, are the walls bright pink? Is it a very female-centered space? How does that work for trans men who might need to attend? How does it work for cisgender men that might need to attend? especially if they have Klinefelter syndrome and gynecomastia. There's so many additional things, and I think it's understanding that the recommendations that Eva's making and that Answer Cancer makes are actually going to benefit the wider community as well. I think a lot of our work is seen as an additional process on top, but it actually improves things for everybody. A really good example of that is in the GP system. So the call and recall system's inability to invite trans men for cervical screening, which is hopefully going to be improved. And when it was suggested that they could improve the system, there was a bit of a pushback from primary care. Well, this is an additional process, and how's this going to work, and who's going to do it? But as we've touched on today, the reality is that actually finding a workaround is the additional process, and it takes so long and it's such an effort. So the reality is as we change the internal core systems of the NHS, for example, at present, you only have a single sex marker, which means when you reassign your gender in your records, that becomes your gender marker, and this is where we get lots of errors. If we had your sex assigned at birth marker as well as your gender identity marker, it would make all of our systems work so much better. So it's understanding that when we are asking core aspects to change, it's because really fringe benefits will only really permeate the system so far. So bits of work like this need to push momentum. And if you're able in your own capacity, in your own environments, to push things a little bit further forwards and join that momentum, then please do.
Thank you, Stuart. Yeah, that's really it, isn't it? You know, there are workarounds at the moment, and that essentially is causing more work. So we need to all come together and focus on just getting right to the heart of it, so that the time spent on those workarounds can be dedicated to other things. And yes, it will mean an investment in time up front now, but in the long run, it will have so many benefits for all. So we were going to run through a pack that we've created, but given the time, that will be sent out to everybody. It's just a summary and some key points from today's session. So
sorry to interrupt, Eva. I'm sorry. We've had a question from Marlo, which I really wanted to get in before the end of the. So I feel like I've constantly cut you off, and I'm so sorry.
All right.
So Marlo, this is really important, and I know it's been brought up before. So I had a quick question about emotional support around screening, and for those who experience gender dysphoria, the nature of screening can intensify mental distress as well as social aspects. And I was wondered if there's anything around signposting to gender inclusive support pre and post screening, or ways of easing the discomfort during the process. Aware that we are low on time, so don't worry if it can't be discussed, but no, I think it's a very valid point. And I know that some of the suggestions around there was about buddying or having a pre-screening call.
I've had a conversation with Tracy from Bolton Trust, and I've suggested the idea of a buddying system, like an LGBTQ plus champion. Most trusts have them these days. You know, if you can have a pride team, you know, to push those things, why not extend the scope of that ever so slightly? For example, they can help and get involved in staff training, awareness sessions, but also be there as a port of call for people who might find that the idea of going for screening incredibly triggering. To you know, if possible, I mean, I've even said, if they could just help to be there just as a physical presence on the day, if that's possible. Just little things like that to really show people that there is support, because you know, you just literally rock up on your own and you're expected to fend for yourself in a system and in a space where you don't know what's going to happen. Anything can happen. So yeah, I mean, the more we can provide for that, the better. And you know, at the moment there is emotional support for other groups around healthcare as well. So why not just, again, we're not creating more work, we're simply broadening the scope of that and extending that.
I think absolutely, and I think you know, I think sometimes there isn't that sort of family support or friend support that person can call upon to support them through that. And so having that independent buddying system would be really, really beneficial. One last question, I promise, and then I'm going to have to shut this down because I could just talk about this. and is the central change to the 2 gender markers are underway now. I know, Stuart, you did very well to get that in the conversation, but do you want to answer that question just very quickly, and then we can end on a high and the pack?
Yeah, definitely. And I'm also happy to defer to Kay if Kay's got a viewpoint on this as well. So that kind of 2-step marker, which then lines up with LGBT Foundation's recommended best practice for trans status monitoring, is something that we were sort of trying to push for. And it was being discussed as being trialed in primary care, but then since those conversations have gone dark, so it's definitely on people's radar. And I had the opportunity to ask Amanda Pritchard directly some questions, and I asked specifically about data and generally the NHS's terrible record on implementing monitoring standards, including the sexual orientation monitoring standard from 2017, but also trans status. Their response was that it's being included in survey data and that should suffice, but obviously it doesn't because it's not attached to clinical record. It's very different data sets. So it's something we'll keep pushing. Yeah, very much. Jump in, Kay, if you can.
Oh, thank you. I'm sorry I've taken over the chat a little bit this lunchtime. It's just as practice managers, we're really keen to get this right, and we're pushing PCSE, who are the organisation that manage the kind of central records. And there's lots of reasons that they give us that they can't do it quickly, but we don't think that they're good enough reasons, and that there should be a way that it can be changed, even if it's hard. You know, stuff's hard, isn't it? So we're pushing, but I haven't got a magic wand or even a stick to beat them with, so we're pushing.
Thank you, Kay.
And just have a conversation or mention it if you can, or if you feel that if you're in a meeting with anybody and you happen just to go, do you know, I had this, and I think the more people that are talking about this, and I think this is it, I think it's, then I'm hoping on the back of this such a positive meeting, that these sort of conversations can now start to trickle out amongst all the allies in the NHS. So Eva, I'll shut up now. You can close on a high and talk about the pack, and then we can end.
Okay, thanks, Vanessa. So yes, the pack will be going out in the email to everybody who's attended. Summary of points will be in there along with the pack that I mentioned. I'll make sure my email address is in there as well for anybody who wants further information or wants to contact me to discuss anything, and I'll make sure to live through this, their details in there as well. So yeah, thank you very much for attending, and I hope everybody has been able to take something away. Today is Trans Day of Visibility, so it was important for us to make sure that it took place on this day. And as much as this day is for trans people to be visible, to talk about our experiences and to share that, I think it's time that we start opening up days like this also for allies to talk about trans people as well. Signposts to trans related services, talk about what allies can do better for trans people, really open up that conversation, because we're on the cusp of something now. You only have to look at the media to see that the change is coming. Whether it's good change or bad change within the healthcare service is entirely down to us. And yes, it needs a bit of push, but nothing was ever changed if we just leave it. It's down to us to keep fighting and to keep pushing. So thank you so much, everybody, and I hope to speak to you all soon.